Good afternoon, everybody. This is Scott McGann with the Falmouth Health Department doing our COVID-19 update, today being September 11th, 2020. The Falmouth Health Department's website is falmouthmass.us. Our email is health@falmouthma.gov, and our phone number is 508-495-7485. Excuse me one sec. So, let me just click this off here. So as of today, there's 251 cases of COVID. That's since the beginning of the outbreak on March 19th. There have been 10 cases since last week and this week, both locally and out of area acquired. Actually, if you look at the state site, when we go down, there'll be 252 because sometimes after the contact tracing, it belongs somewhere else, and that's what happened over the last couple of days. So most of those cases were in that August, the last week when I did the September 4th, August 28th to September 4th, we had 6 of those. So, we've had a few cases, 10 cases over the last couple of weeks. About 97% of our are no longer in isolation. Falmouth remains around 15% of all cases, so we've been averaging somewhere between what we would expect for our population as being about 14% of the population on the Cape. And again, the VNA, the CTC, which is the Contact Tracing Collaborative, the Community Tracing Collaborative, actually, with the support of the Health Department, continue to perform isolation and contact tracing on each case like we always will be doing. If you look at our weekly case trend, last week was 6, this week is 4. Hopefully we keep going down to like nothing or 2 or something like that. But we've pretty relatively consistent since June, where we've been averaging under 10. Some weeks we've had 0, some weeks we've had a couple, some weeks we've had 4. So, sort of in still that range, except for the 1 week we had quite a few at the end of July. But we've been, for the most part, remaining underneath there. I like to see it definitely less than 5, and 0 is always a great number. So that's where our weekly case trend. If you look at our, curve again, it was really bad in the beginning. We were averaging as much as 40 cases, a week plus. And we've had a couple of times where we've had some bad weeks where we had the nursing homes and we had the lifeguards and things of that nature. And hopefully we continue to keep that flat. So you see, like, we have a little bit of peaks and then we flatten out. And hopefully we flatten right out. We do have school opening up, and we want to make sure we have little to no cases as when that happens. If you look at where we were last week, we were in the gray, which is less than 5 total cases. The green is less than 4 cases per 100,000 population per day. So that would be us, somewhere 1 point something cases per day or less. And you can see that we are in the green now, and we'll talk about that in a second. And of course, the less population you have, you see like a case like Chatham, they've got 8 cases and they have a low population. They may jump, and they jumped into the red category. I don't know what the instance, what occurred there in particular. But for our purposes, today we're in the green. Next week will probably still, even if we didn't have any cases, probably be pretty close to green. I'd have to see it when we get closer, but we did have 4 over this week, and so we'll see where we're at. Looking at the last 4 weeks, this is the state's website that comes out every Wednesday. As part of the daily update, you get a weekly update. Our average daily incidence rate per 100,000 was 1.1 on 8/20, and then we got into the 0.5, 0.9. We were doing well. We went to 2.3 due to those the higher number of cases than usual. The 252 is now down to 251 because some cases do get exported out or brought in. It depends on each contact tracing and what's going on there. Our number of tests were 1,616, which is about a little over 800 a week. That's a very good high testing. Positivity was 10, which is a positivity rate of 0.62. If you go down to the bottom here, the state's average of per 100,000 is 4.6, and a positivity around just under 1%. In terms of Barnstable County, we matched Barnstable County for this week, having a 2.3 and a 0.9. Their positivity was a little higher because we tested more per population at our number. So our number's lower of 0.62% positivity, which means 6 in 1,000. They were more like 10 in 1,000 or 1 in 100 and for the state and for Barnstable County as well. So those are the numbers for that. And again, these metrics are going to be used during school time when to determine where we should be as far as remotely or in person fully or hybrid situations based on these colors. And it's not just the colors because, like I've said in previous ones, there might be some extenuating circumstances. For example, Chatham might have, I don't know specifically what's happening in Chatham. I try to keep my blinders on with Falmouth as much. But it could have been, it could have been an assisted living facility. It could have been something that was a congregate living arrangement that caused it all. Something like that can happen. So sometimes you have to look at that and say, well, it's not really the general population. It might be mostly something that's a closed population. But here or there, we're at green. But I just wanted to mention that this is to be used as a guidance, but not a hard and fast rule. So these numbers and these charts come out every week on Wednesdays. As far as this is again on Wednesdays as well, our testing rate, we're in a dark color down here on the left. It shows that we're doing fairly well with our testing rates. And our percent positivity is in the mid range. I like to see that white or very light in the light lavender color. But our percent positivity falls in that 0.57 to 0.83 range. Again, you want the darker color for testing rate and the percent positivity to be a light color on the right. And again, you can get these charts every Wednesday. From Barnstable County, you can look at since the beginning, the number of daily cases as it goes. You can see that we had obviously more cases in April and May where we were getting a grasp on this. We did really well in that late May to June, and then again late July, just like Falmouth did, we had extra cases. Of course, our numbers do go into this. It does affect it. And then in that mid-August, we were doing really well, and then we've had an increase, but then dropped just recently over the past week. So you do tend to have this wave of up and down. But in general, these are, the numbers look fairly consistent from about late May. We seem to be doing a good job since late May for the most part. Number of cases this is the Thursday dashboard. This is the daily update that's also on the state's website, and this is updated around 4 o'clock. Barnstable had 4 cases with a total number of confirmed cases at 1667. If you go up top, you saw that it was 1905 because that also includes probables. When we talk about antigen testing, this one would include antigen testing. This one down here would just be the PCR tests. So total number in Barnstable for the day was 4. This is the state dashboard. This is the daily dashboard. We're still on the relatively, I think, higher end of number of daily cases. There's really like 5 or 6 communities that most of these cases seem to be coming out of. A lot of them in the Boston North Shore area. The number of deaths have been averaging between 10 and 20, which I think is still on the high side. And if you look at the status that we use as a measuring tool, that we've been yellow for the number of died. We haven't gotten into the green. And I think that we want to see 5 or less per day or some number like that, and we haven't gotten to that point yet. Again, there's a delay with deaths, so these could be cases from July or early August. Not sure because again, I'm not only involved. Only have privilege to know what's going on in Falmouth for the individual cases. Total number of tests issued are pushing 3 million, which is a good number, and 15 to 20,000 tests per day has been somewhat the average on this chart. If you look at this dashboard, I tell you always keep looking at the positive molecular test rate. It's 0.8, 0.9, below 1. If it gets below 1, that means the disease does not appear to be advancing. It seems to be declining. We're kind of right on the cusp and been right on that cusp of 1 for some time now. Hospitalizations has gone up. We were doing the low 302, 303 in that early September range. We're up to around 330, 340, so we're actually at 13% higher than our lowest value. LOV means lowest observed value. Back in late August, late August, 29th was the lowest number. Surge capacity does depend on the hospital and how many normal sort of regular things that they have to deal with every day. They're at 2 and the lowest has been 0. And death rate is actually down a bit. We had a few good days in there, but we've been fluctuating between 8 and 15, roughly 8 and 16. Hospitalizations is actually, if you look at the last few days, 10, 6, 10, and 17 has been an increase. So we're actually up 43 from September 4th. Not on the Cape. If you look at Falmouth Hospital, Cape Cod Hospital, we've been doing between 1 zeros. I think Cape Cod had 2 at one point. None in the ICU, 2 hospitalizations. But this could be related to a few nursing homes or congregate care where there's been high-risk individuals. Not quite sure why, but the state has had an increase in number of cases, number of hospitalizations of 43 since September 4th. ICU and intubations are still down. They did have 10 yesterday. They were down 9 the other day, so they're down 22 from August 7th. I think they were down 2 from last week. Intubations down 18 from August 7th, and down. It's been relatively sort of flat, but on the downward trend for intubations. Number of deaths associated with long-term care has been 5,878, and we remain unchanged, which is a good thing. No new cases at any of our assisted living facilities. As far as COVID testing, drive-through is still at the Falmouth Hospital by appointment. Your physician will determine the need. You'll get an appointment. The call center that your physician would use is 508-862-5595. You can also still get it at CVS in East Falmouth. Walk-in clinics do it, like Convenient MD, and the Community Health Center of Cape Cod will also do it in Mashpee. They also do asymptomatic testing as well at the Community Health Center. And if you're traveling or here on vacation, with mass.gov COVID-19 testing. A little bit about COVID test again. PCR is on the right-hand side, detects the viral DNA. It's the gold standard. It's what tells you, it's what the Mass Department of Public Health considered confirmed. So when we had the 251 confirmed, those are PCR tests. They are very accurate. They tell you that you have active infection or active viral RNA in there, in your body. It does take greater than usually 24 hours to several days in order to get a result, so that's the disadvantage, and you should be isolating yourself pending your results. The other tests are antigen, which tells you it does indicate a current or past infection or a recent infection. It is very rapid. That's the benefit. It's not nearly as accurate as PCR, but does indicate a possible current infection. And the Department of Public Health consider those a probable. We will contact trace those like they were confirmed, so we treat them as a confirmed case when we do contact tracing. This is probably the future. Antigen testing, we need to get antigen testing is one of our key. If we can get it to be real accurate, real cheap, real fast, that might be the strategy that we use the most. And that is probably a couple months away or two, 1 or 2 months away, where I think we can get better antigen and more readily available antigen testing. I think that might be more of the future. And then perhaps follow it up with a PCR. The third one is antibody, which detects antibodies in the blood. The accuracy is questionable sometimes on this. It indicates a past infection, usually 3 weeks or more. And the Department of Public Health doesn't consider those to be suspect. They're not really used for contact tracing purposes. Flu shots on September 26, 2020, from 8 to 12, no appointment necessary. Everybody in Barnstable County can go to this one. At the Barnstable County Complex, there's going to be a drive-through clinic. I'll be there. We're going to have the quadrivalent, I can't even pronounce that, influenza vaccine, immunizing age. Also, we're going to do 6 months or older. There'll be high dose for those over 65, and state vaccine is available for the uninsured. If you can get to this one, you should. Also, your pharmacies, your local physician, how you normally would get your flu shot, it would be the second way you would go. I'm working on getting some additional vaccines in order to have a drive-through clinic, working with the VNA to obtain enough to have a clinic. They are going to start, people are ordering them. The good news about flu, and Dr. Fauci had Selectman Patterson sent me a nice hour-long talk from Dr. Fauci, and he did mention that they're seeing in Australia the lowest flu rates, which makes total sense because social distancing and mask wearing is going to work on the flu, just like it would any respiratory virus that's going to float around in the air or come through droplets. And so they're starting to see a low flu season during their peak, which would be about now. So, but that still very important that we get our flu shots, because first off, you don't want to clog the hospital up when you're dealing with COVID. And also it does mimic COVID, so you don't know if you got COVID or the flu. It's also going to be required for school-age children as well. So I'm doing my best to get enough of flu clinics to get up a clinic. It would be a drive-through. I don't have any details yet. I'm looking at a tentative date I've locked in with the VNA of October 26th. As I'll definitely be advertising that as we get closer. But if you want one on September 26th, you can get one. Just it's a drive-through setup. It's going to be all the health agents from the different towns will be there, and doing a drive-through flu clinic, and we'll have especially if you're over 65, the high-dose flu vaccine. And again, if your pediatrician, your physician, you should contact them to see if what they're going to have for plenty. And then again, you always can go to the pharmacies, the walk-in clinics, and so forth. Town meeting is scheduled for Monday. There's the layout of town meeting with each one of those little rectangles representing a chair. We'll be working on that. I'll be going out there this afternoon to see the layout of it when it's done. That it will be indoors under the guidance that town meetings are exempt from the indoor gathering requirement. And the town moderator decided to have this one set here, and so we'll do the social distancing, mask wearing, keeping people at their tables. No, if you're a town meeting member, no hanging out, no loitering. I'll throw you out. No, I'm just kidding. I won't do that. But just maintain social distancing and so forth in this setup, and that'll be at the high school auditorium, gymnasium, field house, whatever you want to call it, on Monday. Again, social distancing and face coverings. Again, continued diligence with social distancing and face coverings. Frequent hand washing. Quarantine upon arrival from locations with higher rates. That's been required since August 1st. I think we've had somewhere pretty close to 2,000 travelers fill out that form with the state. I just looked at that list of those that did it. So most people I ask guess how many people filled out. People usually say 20 or 30 or less, but we've actually had almost 2,000 people fill out that the 14-day, fill out the state form on the out-of-state quarantine requirement. Again, stay home when ill, follow the state guidance, especially if you own a business and you need, or some sort of entity, a sector-specific entity, you follow your state guidance, and we can help that if you want to call us about details. We continue to follow up the social distancing and face masking complaints. We follow up as many as possible. We get to all of them. So last thing, obviously, we want to do, especially with school opens, to undo the hard work that we've done before. And so, let's keep going with this fight, and that's what I got to say about that. As a recap, state metrics, I think, have been a little bit higher on the hospitalizations this week. Cases are a bit higher. Deaths been between 10 and 20. Falmouth cases increased last week and last weekend, and hopefully we'll flatten that out. During this week, it has not had as many cases. Current level in Massachusetts is phase 3, step 1. So that concludes the recap for this week, and I'll see everybody next week. Thanks.